Absolutely. Today we have a total of 23 positive COVIDs in-house. 14 of those are in our critical care, with 7 of them vented. We have 9 on 8 Central. At the mix, we have 1 Andrews, 1 Monahans, 1 Stanton, 2 Pecos, 1 Fort Stockton, and 2 from Deering's Nursing Home here locally. Our total of all of our locations, we have 1,174 positives, 4,237 negatives, and we have 52 tests pending from last week to this week.
Thank you, Kristen. Dr. Benton, Dr. Davenport, do you guys have anything to add to that?
You're asking us in that order, I guess.
That's the way it just comes up on my screen. I've got Davenport and then Benton.
So, a little bit of encouraging news out of the health department. The cases seem to continue to trend down, which I guess we might suspect from the hospital numbers. But total cases last week looks like was about 244, which was about 220 less than the previous week. So the curve, the rolling 7-day average for new cases has been declining. And now even the cumulative positivity rate has declined. It's dropped back down to 17. So not a big drop, but it is improving. And then also the health department did get results from the National Guard testing. That was July the 24th and the 25th. So it's a couple weeks old now. But it was finally passed over to the health department. There were 70 tests done apparently and only 1 positive. So that's all I've got.
All right, thank you for that, Dr. Benton. Certainly seems like it's good news and trending in the right direction. Stacy, do you have an update on ORMC's numbers?
I do, Trevor. Thank you. Odessa Regional has tested 2,097 individuals, 358 of those positive. Only 4 pending currently, which is the lowest we've had in weeks, if not over a month. Current in-house, we have 12, with 9 of those in ICU and 3 on med-surg, and only 4 of those vented. Of those 12, 4 of them are from out of area, 3 from Big Spring and 1 from Andrews. And so we've seen our overall positivity rate drop as well. We were at 17.7% just for the ones that we tested a week ago, and that's down to 17.1%, which is cumulative since we started testing in March. And so it's good to see that percentage come down at Odessa Regional 2, as Dr. Benton mentioned. That's all I have, Trevor.
All right, thank you, Stacy. Dr. Saravan, are you still there? Did you want to add anything?
Yes, I'm still here. Sorry if I keep getting disconnected on the computer, but can you hear me on the phone okay?
We can hear you.
Okay, yeah, so nothing else new to add really, just the encouraging news overall that the new cases are on the decline, and that's always good to see. We really have to see what will happen with some schools still going back in person when school season starts, and we'll see how that affects the cases as well. That's the only thing to look forward to in the next week or two.
All right, thank you, Dr. Saravanan. I'm going to read the numbers from Friday real quick for the county. 3,531 total cases, 2,412 of those are confirmed with 1,119 probables. The number we're watching that seems to have been going down is active cases, only at 800 now, with 2,675 recovered, 56 deaths, and the positivity rate at 19.6%. So that was the county numbers updated Friday. I believe they will update again at 5:30 today. Let's go ahead and get to media questions. And first up on the list is Mike Merlot, Odessa American.
Yeah, hi, Trevor. Dr. Benton, I guess I only have one question today, and that would be for you. And it's about the National Guard testing. Has the health department seen calls from people still who haven't gotten their results from the National Guard yet?
I'm not sure if they have had calls or not in the last few days. And really the reporting of the results should come out of the state to the patient directly. Now,
Okay.
the health department will contact the positive to do contact tracing. So that, I suspect that person's already been contacted. The rest of the results, I'm not sure if the state will call all the negatives or if they just call the positive people, whether people are to assume they're negative if they don't get a call.
Okay, but the health department will contact those people a second time. If
They
they're
will
positive.
contact a positive. The reason the data is given to the health department is to do contact tracing.
Right. Okay. Well, thank you. Yeah, I appreciate that. That's all I have today. So.
All right, thanks, Mike. Yeah, next one up, it looks like I've got is Marcos. Marcos, do you have anything, sir?
Does either hospital just want to comment on the downward trend in hospitalizations and what that reflects for the community?
Kristen, do you want to take that one?
Well, I was actually going to say, I think Dr. Benton can correlate our downward trend in cases in the community to our hospitalizations. So I'll let him kind of expand on that.
I guess the first immediate answer is, hey, that's great news. Fewer people in the hospital is always better. But I think the hospital is a little bit of an indicator of what's going on in the community. You know, unfortunately, those who get in the hospital are sicker, and so they're around a little bit longer. But as that declines in time, then that should follow it follows later what the community is doing. So I think the hospital is a good indicator, and cases dropping at the hospital is a sign that maybe the virus is a little less prevalent. It's not zero, it's still out there.
All right.
That's the only question I had.
Anyone? Okay, thank you, Marcos. Up next, I believe, is Mitch from Marfa Public Radio.
I'm okay today. Thanks, y'all.
All right. Thank you, Mitch. And next up I see is Scott somewhere on there. There you go, Scott.
But y'all don't think there are fewer positives because it seemingly feels like we're testing less, right?
I don't, in my opinion. I really do think that the things that we're doing, the mask wearing, the social distancing, the spread of, I think it's all starting to come together, because I know at Medical Center we're not testing less. We have less pending because we're getting our results quicker, but we're not testing any less.
Right. And Scott, the positivity rate is coming down, and that's the point, right? So it doesn't matter if you test less, the number of people that are turning positive is coming down ever so slightly, though. So not anything to be overwhelmingly happy about, but it's a positive trend, and so that's what we're pointing at.
Great, that's all I have. Thank you, guys.
Thank you, Scott. Did Jared, Channel 2, did you have anything? All right, I guess not. Just to see a question that scrolled by Facebook that seemed interesting. This more for the doctors and the medical professionals. Have we seen anybody claim or have we seen anybody have a reinfection yet? We've seen obviously cases where they remain positive and test positive for up to even 6-7 weeks, some people. But have we seen it where it apparently will be a positive, you have a negative test and then test positive again? Have we seen any of that around here that you know of?
I haven't known of any cases, and in general, in reading CDC guidelines, they don't feel that reinfection is a big issue. Have you seen any different over at ORMC, Dr. Saravan?
Just a couple of cases, Dr. Benton, is the one lady, you remember, that had a negative test, was discharged, and then came back, was positive, and ended up passing away. That's probably the only case I remember off the top of my head. Reinfection is a good question. It may or may not be reinfection with a new strand of the virus. It may be that you don't have enough of a viral load to test positive, so you'd have a negative test because of the treatments that you had, and then come back with a higher viral load, possibly the same strain. So I would say reactivation more than reinfection. What do you think, Dr. Benton?
Okay, I would agree. The general guideline is that any test positive again within 3 months is not considered a reinfection, but rather probably the same illness. So reinfection does not seem to be something that we're seeing.
All right. Thank you guys for answering that. Wanted to ask Dr. Davenport real quick. I know surgeries started opening back up again last week. Everything going good with that, Dr. Davenport?
Yeah, everything seems to be going really well. I think elective schedules picked up. I think over the next couple of weeks, we'll see our numbers getting back to normal. We'll probably be above average for a short time, getting some of those procedures back in that we've delayed, but we're back on track.
Awesome. Good report. Thank you, Dr. Davenport. Does anybody else have anything they would like to add before we join back on Wednesday? All right. Kristen, do you want to finish this out?
Absolutely. Just want to read a verse out of Matthew 11:28-30 that was in my devotions this morning. Come unto me, all you that labor and are heavy laden, and I will give you rest. Take my yoke upon you and lean on me, or learn from me, for I am meek and lowly in heart, and you shall find rest into your souls.
All right. Everybody have a good rest of the day, and we'll see you guys all on Wednesday.